ADN versus BSN. This is the road to RN, how to choose a program. The only real difference between ADNs and BSNs is that the BSN program prepares the nurses to be a little bit more elaborate in their care as far as evidence-based practice goes and research goes. But other than that, guys, we are all expected to deliver high quality care to our patients, safe care, and to be prudent and knowledgeable in what we are doing and carrying out. Again, we practice under the same umbrella, we practice holistic care, and we have the same values as in both programs. Now we're going to break it down. Let's break it down. What is the difference? What's the difference between the ADN? What's the difference between BSN? So first, let's start with ADN. We are going to break it down as to where you can practice. What clinical settings can you practice in? As an ADN, you are limited in some clinical settings where you can practice. Most often, you can practice in community hospitals, rural areas, and pretty much almost any specialty, except for maybe ICU, but maybe not in rural settings. Outpatient settings, pretty much anywhere outpatient, whether it's home health, primary care, or even specialty settings. You guys are equipped to practice pretty much anywhere out there. Even urgent care settings, you guys can do that as well. But of course, it varies from where your location is at, so do your research. Lastly, what are some pros? Why would you choose the ADN route? So, one, it's cheaper. Tuition is way cheaper than the BSN route because you are doing the ADN in a community college versus a university. Another thing is, it's often less competitive to get into. This can be true for some locations, not for all, but for some, it often is a little bit less competitive. Maybe GPA doesn't have to be as high for a BSN. You do take less courses than you would for maybe a BSN program. But of course, it varies from program to program. And lastly, the thing that you have to ask yourself is, what is my end goal? Do I just want to be an RN and that is my end goal? And if so, then great, perfect. You're done at ADN, no need to continue advancing. But if in your head you're like, you know what, maybe I want to do a BSN, maybe I want to get my master's, I want to be a nurse practitioner. To me, I'm like, well, are you really saving time? Are you really saving money if you go for your ADN, then you go for BSN, then you go for MSN? For me, in that case, go straight to BSN. There's no point in wasting time. You're going to waste, 3 to 4 years getting your ADN, another 1 to 2 years to get your BSN, another 3 years to get your master's. Why not just finish your 4 years and get your BSN? So if that's the case for you, that's something that you should probably consider. So now let's jump into the BSN program. Why would you choose a BSN program? The BSN program is the preferred program for most employers. You can pretty much practice anywhere as an RN with a BSN. So if you want to work in the ICU, you want to work in a level 1 trauma center in the ER, you want to be in any high acuity, that's what you want to be doing. You want to get your BSN because that's what most employers look for. Also, if you want to work for a magnet setting hospital, those are nationally recognized. It's literally what we call a magnet. That means nurses want to work there, they take care of their nurses, and they really look out for what they call recruitment and retention. They really want to keep their nurses happy because they know that nurses are the heart of healthcare. So if the BSN program is for you, there are opportunities for advancement as far as career advancement. Most employers look for BSNs to take on higher roles within the institution. It's a great way to advance more quickly. Also, if you guys are then wanting to go back to graduate school, maybe get a master's in education, or maybe an FNP, nurse practitioner, CRNA, whatever it is that your goal is, this will definitely get you there faster. You already have your BSN, now you just have to apply to either get your MSN or even your DNP. Additionally, for the BSN programs, there are some programs that allow you to finish way sooner. My program was 15 months long. I'm sure that there are programs that you can look into that are short like that. Of course, it is competitive to get into just like any other program, but if you can find one, they save time, they save money, and I'm all about advancement. But don't get me wrong, guys, not all programs are like that. Some of them do take the full course. It can take 4 to 5 years, I've heard, especially in California. But do your research, look around. So at the end of the day, guys, I can't make that decision for you. You have to choose what program is right for you. Do your research, do some deep soul searching, figure out what it is that you can and can't do, and align it. choose the path that'll be best for you. Like I said, I don't know if you have a kid, if you're married, you have whatever the case is, or are you just a fresh high school student, or maybe you have a supportive family that can help you. I'm sure that you can see yourself through it. Every path is different. I don't know your circumstances, and each circumstance does play into which program you're going to choose. Whether you just need to be done, you can't be in that much debt, then that maybe the ADN route is best for you. Or you know what, I'm determined, I don't want to get my master's, maybe my doctorate, and I'm going to go straight for my BSN. That's something that you have to choose, but I know that you guys can do it whatever path you choose. We're all nurses, and welcome to the gang. I love you guys. Make sure to like this video, make sure to subscribe, please make sure to share with everybody. And as always, I believe in you guys, and I'll see you in my next videos. This is hard work, guys. Cherry, we did it! We did it!